Nursing MCQs 101200. 1. Which of the following is the best indication of fluid volume overload? Correct option is B. Jugular venous distension. 2. What is the primary electrolyte imbalance in Addison's disease? Correct option is B. Hyperkalemia. 3. Which of the following describes the pathophysiology of heart failure with reduced ejection fraction? Correct option is B. Impaired contractility. 4. The normal power in arterial blood is approximately A. 2040 mmHg, B. 6080 mm. Correct option is C. 80 to 100 mm Hg. 5. What is the first drug of choice for acute supraventricular tachycardia (SVT) in the hospital setting? Correct option is A. Adenosine. 6. Which vaccine is contraindicated in pregnancy? Correct option is C. Live attenuated rubella. 7. What is the best site for intramuscular injection in infants 12 months? Correct option is C. Vastus lateralis. 8. Which of the following is a sign of hypoglycemia? A. Dry skin. B. Sweating and tremors. Correct option is B. Sweating and tremors. 9. What is the priority nursing action for a patient having a seizure? Correct option is C. Protect from injury and maintain airway. 10. Which acid-base imbalance is characterized by high pH and high PaCO? Correct option is C. Respiratory acidosis with compensation. 11. In burns, what does rule of palm estimate? Correct option is C. Body surface area percentage. 12. In shock, the earliest sign is. Correct option is B. Tachycardia. 13. What is the standard prophylaxis for deep vein thrombosis (DVT) in postoperative patient? Correct option is B. Ambulation plus compression stockings. 14. What kind of isolation precautions are needed for a patient with C. difficile infection? Correct option is C. Contact and gown plus glove. 15. Which drug is used to reverse opioid overdose? A. Naloxone. B. Flumazenil. Correct option is A. Naloxone. 16. What is normal platelet count in a healthy adult? Correct option is C. 150,000-400,000 mm superscript 3. 17. In a patient with COPD, which ABG finding is typical? A. Respiratory alkalosis. B. Metabolic acidosis. Correct option is C. Respiratory acidosis with metabolic compensation. 18. What is the term for inflammation of the heart muscle? Correct option is B. Myocarditis. 19. What precaution should be taken when administering potassium intravenously? Correct option is B. Dilute and infuse slowly. 20. Which type of wound debridement uses natural enzymes? Correct option is B. Autolytic. 21. For a patient with right-sided heart failure, which symptom is most likely? Correct option is B. Jugular venous distension and peripheral edema. 22. What is the major cause of type 2 diabetes mellitus? A. Autoimmune destruction of beta cells. B. Insulin resistance often combined with relative... Correct option is B. Insulin resistance often combined with relative insulin deficiency. 23. The earliest sign of hypoxia in infants is? Correct option is C. Restlessness and irritability. 24. Which antihypertensive class can cause a dry cough? Correct option is C. ACE inhibitors. 25. Which prenatal test is done around 20 weeks to assess fetal anatomy? Correct option is C. Anatomy ultrasound. 26. What is the correct order for donning PPE? Correct option is A. Gown, gloves, mask, eye protection. 27. What is the best way to prevent ventilator-associated pneumonia? Correct option is A. Head of bed elevated 30 to 45 degrees. 28. Which of the following describes hypovolemic shock? A. Pump failure. B. Loss of circulating volume. Correct option is B. Loss of circulating volume. 29. What action is most appropriate if a patient pulls out their intravenous line? Correct option is B. Apply pressure to site, bandage, notify physician. 30. What is the correct way to take a nasopharyngeal swab? Correct option is A. Insert straight back horizontally until resistance, then rotate.
31. What is the peak flow test used for? A. Diagnosing COPD. B. Monitoring asthma control. Correct option is B. Monitoring asthma control. 32. What is the hallmark of diabetic ketoacidosis? Decay? Correct option is C. Ketosis plus metabolic acidosis. 33. What is the best way to administer oxygen to a COPD patient? Correct option is B. Lowest flow to maintain target Saturday, tilde 88-92%. 34. What is a complication of long-term corticosteroid therapy? Correct option is B. Osteoporosis. 35. What is the most serious risk with a central venous catheter? Correct option is B. Infection and sepsis. 36. What is the recommended interval for changing an foresight in adults? A. Every 24 hours. B. Every 487 HRS. Correct option is B. Every 48 to 72 hours. 37. Which of the following is a congenital heart defect where there is a communication between the aorta and the pulmonary artery? Correct option is B. Patent ductus arteriosus, PDA. 38. What is a sign of increased intracranial pressure? Correct option is B. Bradycardia with hypertension, Cushing's triad. 39. Which is most effective in preventing spread of HIV in healthcare settings? A. Universal precautions and safe needle use. B. Correct option is A. Universal precautions and safe needle use. 40. What is the main cause of an embolic stroke? Correct option is B. Embolus from elsewhere, heart or large arteries. 41. Which drug class is used as first-line therapy in acute asthma exacerbation? Correct option is B. Short-acting beta agonists. 42. What is the normal capillary refill time in fingers? Correct option is D. 4 seconds. 43. What is the priority nursing intervention for a burn victim on arrival? Correct option is B. Stop burning process and ABCs. 44. What is the term for liver cell injury due to alcohol consumption? Correct option is C. Steatosis, fatty liver. 45. Which of the following is true about TB treatment adherence? Correct option is B. Directly observed therapy improves compliance. 46. Which laboratory value indicates renal impairment? Correct option is B. Elevated BUN and creatinine. 47. What is the correct landmark for chest tube insertion for pneumothorax? Correct option is B. Midaxillary line, 5th intercostal space. 48. What should be included in the assessment of pain? Correct option is A. Location, quality, intensity, duration, what relieves or worsens it. 49. Which of these is a sign of digoxin toxicity? Correct option is B. Blurred vision, halos, nausea. 50. What is the best nursing management for retention of urine? Correct option is B. Scheduled toileting and bladder scan.